Hi, my name is Dr. Jane Hendricks and I'm a naturopathic physician. Now, why would a patient want to go to a naturopath over their conventional MD? After all, more than likely your insurance does not cover a naturopathic doctor. Well, first of all, the main reason why you'd want to come to a naturopath is that we treat the underlying cause of disease and symptoms. What this means is you could discontinue your medications and have a higher quality of life. When we find the cause, the body will resolve the symptoms and come into balance. And this is such a powerful path to take towards healing, and it's very much anti-aging. When you take medications to suppress symptoms, the disease will still progress, whether it be cardiovascular disease or diabetes. Diabetes is managed, it's not reversed in conventional medicine. Naturopaths work on reversing diabetes, getting you off the metformin, maybe even lowering the amount of insulin and discontinuing the insulin for type 2 diabetes. We're all about anti-aging, we're all about reversing disease, but to do so, we have to spend more time with the patient. My initial office visit is about 75 minutes, including the physical exam for an in-office visit. And this is to discover the underlying cause of chronic disease and symptoms because we need more time to collect a medical history. In addition, we may order specialized testing. So we'll take any recent blood tests that have been done by your primary care, but we look inside the reference values, the reference ranges for high normals or low normals. This means we don't wait for that blood test, that reference or your number to be out of range. We want to catch it before it gets out of range. For instance, cholesterol or triglycerides or thyroid. Let's treat it or prevent it from ever going out of range. Or anemia, that's very important for anemia as well. It's very hard to get out of anemia once you're there. So we may do specialized testing in addition to blood tests. This could be salivary DNA testing, could be food allergy testing, could be 24-hour urine testing for hormones and neurotransmitters. And this just gives us a more objective perspective, in addition to the medical history, to discovering the root cause of the symptoms and your diagnosis. Lastly, and most importantly, we look into your lifestyle. We may be doing things in our life day to day, day in and day out, that is contributing to the progression of the disease and symptoms. It could be very profound to remove something out of the day that you're doing that might be causing more illness. It could be something you're eating. It could be a lifestyle habit of too much stimulation, and that's what's contributing to the anxiety or insomnia. And we just think there's something wrong with this and we have to take a medication. It could just be a very simple lifestyle modification that could have a profound impact on your quality of life. So we have longer visit times, specialized testing, and we do delve into lifestyle. These three things are very impactful into helping patients get off their medications, reverse their disease, and slow down the aging process. For more information, fill out my contact form for a free 10-minute consultation. I'll be happy to answer any questions you might have about the process of visiting with a naturopathic physician. And last but not least, naturopathic doctors have licenses to practice medicine. You will want to, if you are in an unlicensed state such as the Midwest, and there are very few naturopaths around, you'll want to make sure that the person that you're calling that has an ND or NMD after the names has in fact graduated from a 4-year medical school and carries a license to diagnose and treat disease. Not all doctors, so-called naturopathic doctors with the same initials, have graduated from those schools and carry a license to practice medicine. So these are very important questions to ask in certain states that do not have licensing laws, such as most of the Midwest. Again, if you have any more questions, feel free to contact me through the form on my website, and you can do the 10-minute free consultation, and we'll go from there.